Welcome to Prime Perspectives, where Keith Galicia guides you to the financial finish line. As a certified financial planner practitioner, he covers all topics in financial planning. Join him each episode to gain insights and strategies, helping you pursue your financial goals together.
Welcome, everyone, to the Prime Perspective podcast, where our goal is to get you to the financial finish line, whether it's anywhere from retirement planning, risk management strategies, investment strategies, college planning, or even if you're a business owner looking for solutions for yourself and for your employees as well. Which leads me to today's conversation. And what we're going to talk about is a very interesting topic. It's called self-funded health plans. We have the Foundation for Medical Care. We have Debbie Hankins here and Angelica Hernandez, and they're going to be able to present to you what a self-funded health plan looks like. So ladies, thank you for showing up today.
Thanks for having us.
Thank you. We're happy to be here.
Absolutely, absolutely. So let's get right into it. Debbie, I don't know if you want to start, but can you tell me a little bit about your background and how you got into the health plans industry?
Yeah, I'm a nurse by trade. About 30 years ago, I became a registered nurse. I worked at a local hospital for 25 years. I did a variety of roles, started off in the ICU, ended up getting into leadership and went all the way and did all sorts of director of critical care and that sort of thing. And I ended up being the chief nursing officer for 6 years at the hospital. So that got me in healthcare. And I was here for 25 years at the hospital. And I thought, you know what? I have this set of skill set, and I really wanted to take a look at the other side of healthcare, which I didn't really recognize it. I thought I knew everything about healthcare, but the bottom line is there's a machine that goes on behind the scenes, making sure that providers, doctors, hospitals, all sorts of providers get paid, as well as process claims for members of a health plan. And so I've been here for 10 years. I've really learned a lot, and there's money to be saved for employers out there with self-funded health plans.
And Angelica, how about you?
Actually, I don't come from a medical background like Debbie does. I came from a dental background. I worked in several dental offices. I'm originally from the Ventura County area. So I worked in dental offices there, managing them, billing coordinator, things like that, scheduling. And living here in Bakersfield, I've been here for about 20 years now. And one day I just saw an ad with Health Edge administrators, and I said, you know what? I think it's time for me to flip my cap. I was working the office portion of it, and I wanted to learn the insurance industry portion of it. And I came in 2008. I started as a customer service rep, learned how to process claims, learned how to work in some of the accounting functions. And I've been an account manager here for the last 2 years now. I'm going on 16 years with the company.
And she's the shining star, I can tell you.
Yeah, she's the one that we got to provide for the information for most of these people here. When you think about, maybe Debbie, you could speak a little bit more onto what inspired you. I know you had said there's a lot of money to be saved there. What was that light bulb that went off that said, hey, I want to work in this side of the industry?
It's really interesting. It's like healthcare, there's lots of statistics out there about that. And so the cost of our healthcare is astronomical compared to other countries. And there's just savings to be made. By self-funding your health plans, every year the cost of healthcare goes up. If you have a company, as you get your annual renewals, and it's always 5%, 10%, 3%, 7% higher every single year. And one way to curb those costs is to self-fund your health plans. And so that really inspired me to be involved in this side of the business, because this could really save employers money and also offering excellent benefits for their employees.
So I think if you're a business owner, you've certainly probably heard of some kind of self-funded plan. It could be workers' compensation, it could be health, it could be dental, it could be maybe some kind of life insurance group plan or something like that. Can you explain a little bit further what a self-funded health plan is and how it differs from your traditional HMO, PPO, or anything like that?
Sure. Self-funded health plans are more efficient and cost-effective because they allow the employer to pay for actual healthcare costs rather than a monthly premium for each employee. This flexibility means savings when claims are low, direct costs over plan design, and the ability to customize benefits to better meet their employees' needs. Additionally, employers avoid paying insurance company profit margins, and there's always those built into their premiums and premium taxes, resulting in overall lower costs and greater financial predictability.
Well, I guess that's about the best way that you could explain that. So when we're thinking about businesses and your ideal client, which is obviously a business, could be a large, small, what type of businesses are best suited for self-funded health, dental, and vision plans?
Well, they're each a little bit different. On medical, we'd like to have at least 200 employees. That is, it spreads the risk around for the employer. And also dental and vision, we can go as low as 5 or 10 employees on a dental plan, and vision as well. And you can have quite a savings, thousands of dollars to a very, very small company by self-funding your dental and vision plans. And we also offer workers' compensation networks. It's a special thing called the MPN network. And we like to have at least 500 employees in that arena. And again, there's about a 20% cost savings, at least from a traditional fully insured on all those types of plans, sometimes even more.
So sounds like as long as someone can, or as long as a business owner meets those parameters, they can certainly save some money. But I'm sure it has to do with a lot of the way that you put these plans together. How do you customize these plans to meet those specific needs of the business owner, beyond saving them money, but also what's important to them for themselves and for their employees as well?
Typically, what we like to do is review their current policy. What are they currently offering their employees before they even consider self-funding? And we'll ask them, what do you like about this plan? What's working for you? What's not working? And a lot of times they'll just completely mimic the current plan that they have, and we'll plug in those benefits and just let it ride for the first year. And we'll show them, like, this is what you were paying, this is what you're paying now, and they'll immediately see savings. Sometimes it could be a couple of months before they see savings, but along the way, we'll provide recommendations. We'll look at patterns and say, hey, maybe you want to change this benefit. It seems like it's costing a little too much on, it could be anything. It could be maybe too many people are going out of network, and we want to drive people to go in network to help save the plan money. So it could be recommendations like that we'll offer them.
So it's not just about the customizing doesn't just happen when you're building out the plan. It's also a continuous process that, hey, we're monitoring this plan for you. This is where we see some areas of improvement. This is how maybe we can implement more employees into the plan to get that overall average cost down. And because you're not looking just to save them money out of the gate, but also in the future and with their relationship with you as well. Is that correct?
We closely monitor their plans on a monthly basis and every expenditure that they have. We also provide the employer with every dollar that they're spending. They know where it goes into what category as well. We provide reports for that.
So I think that really leads me into my next question. And so if you could tell everyone what a third-party administrator is and what services you provide as a third-party administrator, since I think that is your role, correct?
Yes, we're a TPA, and we administer self-funded health plans and manage the day-to-day operations for the plan. This could include processing of claims, managing the benefits, handling customer service, ensuring compliance with regulations. By outsourcing these tasks, employers can focus on their core business while maintaining control over plan designs and costs. As the TPA, we act as an intermediary between the employer and employees, their vendors that they might have. It could be their pharmacy vendor, their providers. We try to ensure that they have a smooth and efficient plan administration.
And we're just taking care of business for them so they don't have to do that part. We also are very much in contact with the broker. We're a partner with the broker that they have appointed for their health plans to make sure our goal is to make their lives easier, the employer and the broker, and to take care of all the business of the health plan so they can do what they do best.
When I speak with most business owners, the top two things that are important to them is time. We only have so much time in the day to get things accomplished. right? So if you can give them more time to be able to do what's important to them, that's a huge benefit. And obviously savings money too. Benefits are some of the highest line items out there for a business owner, especially if you're trying to retain good employees. And if you can have a quality health plan, dental and vision plan, and also be able to save some money on that, that's a win-win for them as well. You've saved them time and you've saved them money. That just makes complete sense to me. But let's look under the hood of a self-funded plan a little bit more. How does a self-funded plan help companies manage their healthcare costs, since that would probably be one of the most important things to a business owner?
Well, you have to compare a fully insured plan to a self-funded plan. A fully insured plan will have a set premium for each employee on the plan. So you'll pay X amount of dollars, and that includes all costs. It includes any claims, anytime they go to the doctor or the dentist. They'll include any taxes that they have to pay. It also includes commissions to the broker. They pay people like my company to do claims and customer service, except the insurance companies have this built into their companies. So all of that money is set in a premium, and there's also a profit margin built into that premium. So every month you pay it straight across. You're paying X amount per employee per month. Now, on a self-funded plan, there's a few costs that are set. Our services, we provide claims and customer service, account management, those TPA services, that's a set amount every month. They'll still have commissions to their broker, and they don't have to pay the same type of taxes that a fully insured plan does. They'll only pay for claims or times that their employees actually use services. So, and then there's no profit built in. So anything that is not used, and also any profit that was built in, that goes back into savings for the company.
Healthcare is a sector of the S&P 500. So it is profitable, right? Some of these companies are traded on the stock exchange, and they have to listen to their shareholders. So I can definitely see there has to be a certain profit margin then for their stock prices to go up.
Right.
And so when you guys can control some of those costs that might be coming out of the employer's pocket or even the employee's pocket, that's definitely where you can see one of the savings there. What strategies do you use to minimize financial risk for companies using self-funded plans? Because I think that's important as well. They think that, okay, if all of this money's coming out of my pocket, maybe I have unlimited risk. But how do you help mitigate some of that financial risk for those companies?
For medical self-funded plans, there's financial insurance called stop loss. And what that stop loss is, it's a like I said, financial insurance that actually protects employers from catastrophic claims by capping their financial exposure. And it's set up to where it's either by each member or a group as a whole. There's two different numbers. And if they reach either one of those, the stop loss company comes in and pays the rest of the claims for that plan year for that particular either employee or the group. Usually it's by the member, employee, or their dependent. And so they're paying for that financial insurance on a regular monthly basis to insure them in case of catastrophics. On a dental plan and a vision plan, there's no need for stop loss. There's money to be saved, and there's not really a lot of risk to the employer. There's not a lot of risk for a self-funded plan for a dental.
Yeah, there's caps, right? It's caps, like I use my dental plan, and the most that they'll pay is out $1,800 or $2,000, and then the rest is up to me. My vision, I pay X amount for my exam. They're going to give me X amount of dollars for my glasses, and we have to stay, once a year or whatever it is. So yeah, that you can definitely see.
And there's no cap for medical plans.
Sure.
According to the government regulations.
Which is where the stop loss helps.
That's right.
Which leads me into a couple of my next questions here. Employers always want to make sure that they are always complying with the new regulations that are out there to make sure that they're taking care of their employees, that they're complying with state and federal laws. How do you ensure that a self-funded plan complies with state and federal regulations?
Well, first off, all plans must be complying with ACA guidelines. We make sure that we're staying up to date with everything. We're monitoring changes in the laws and maintaining required licensing. We also do the plan management portion. We design compliant plan documents, ensuring accurate filings. We also provide claim administration. So we make sure that we're adhering to legal standards for processing claims and appeals. We provide the reporting that the companies need for their plans, assisting them with required disclosures and annual filings. We make sure that they're HIPAA compliant. We actually have a HIPAA compliance officer here that she stays on top of it, makes sure that everybody gets the proper training every year, everybody's following the rules, and we're making sure that we're not sending out information that's not encrypted or protected. We make sure that everything is, participants' data is being protected, and we maintain their privacy. And we also conduct auditing, not only on our claims, we audit internal, and we do have internal and external audits, and we ensure compliance on those as well. The auditing can be on claims, it could be on reporting, it could be customer service that's getting audited by their manager. They listen in on their phone calls to make sure that they're providing accurate information and that they're doing it in a friendly manner. We serve as a liaison role. We act as an intermediary with regulatory agencies. We provide education. We train the plan sponsors on their regulatory responsibilities. So we want to make sure that everybody has all of the information that's needed in order to administer their plan.
Yeah, we have like the experts in the field that we gather information from them, and we have contracts with different agencies and attorneys to make sure that we're getting the latest and greatest information. We watch podcasts. Our company watches podcasts from a variety of different regulatory agencies just to make sure that we're staying the latest and greatest abreast of the new regulations and keeping on top of everything.
Oh, for sure. With the evolution, and I don't know if like the Secure Act has affected the way that you guys do business, there's always an evolution of new laws and regulations. And it is important that you have the way that you do business is, I'm sure you have some kind of template that allows you to say, okay, these are the current regulations. And then having that third-party auditing system is the best way to do it, just to make sure that, hey, we're good at what we do. We're great at what we do, but it's always good to bring in another set of eyes just to make sure that the I's are dotted and the T's are crossed. What are some of the common regulatory challenges business face with self-funded plans, and how do you help them navigate this?
They could face challenges with complying with the ERISA and the ACA requirements that I mentioned earlier, managing state-specific laws. We want to make sure that they're also abiding. We're not the only ones that need to abide by the HIPAA privacy, but the employer also needs to abide by HIPAA privacy. So we want to make sure that they're distributing things appropriately as well. Handling claims and appeals, meeting reporting obligations, navigating audits, staying updated on legislative changes. So as the TPA, we help design compliant plans, maintaining data security and managing claims, assisting with their reporting, supporting audits, and keeping the businesses informed with the regulatory updates.
I dig it. Well, let's talk a little bit about the employees, because if you have a health plan, and self-funded plans are for 200 employees and above, that is top of mind, I'm sure, for those business owners as well. How does a self-funded plan impact employee satisfaction and retention?
I think for the most part, an employee doesn't really notice whether they're on a fully insured or self-funded plan. To them, it's their PPO plan. The plan benefits are typically the same or better, and the employee costs would be the same. So an employer would charge their employee the same as they would for their self-funded plan as they would for their fully insured plan. If the group self-funds with our company, they typically would have better service. The reason I say this is because our phones are answered by a real person in under 30 seconds. And also the broker and the employer would have direct access to an account manager. A fully insured plan doesn't typically interact with the broker or the client, much less even the members. They'll interact with them if they're calling like the customer service team, but they don't have like a direct management contact that everything goes through their broker.
Okay, well that's like your cell phone, right? Like I don't care I just want to make sure that it works, right? I want to make sure, and I guess it's the same way with our health plans. Is when I go to the doctor, I want to make sure that the process claims are being taken care of properly. I'm not getting any phone calls from the blood work company that says, hey, you didn't pay this bill or wasn't billed, and you have to call back just to make sure that the check was sent and all the above. So as long as that's a smooth transition from them visiting their doctor or wherever they needed to go and everything was funded, that obviously creates employee satisfaction, because then they're not a little disgruntled about their whole process of being able to take care of themselves and their families. And we've talked about that from at least my standpoint of the employees. When I build a 401k plan and I'm doing employee education, sometimes people just want to I'm going to put the money in and you decide where it goes and all the above. But I think it's really important that employees understand what they're investing in. And I would think that it's important also that employees understand what they're paying for their benefits. What tools and resources do you offer to help employees understand and manage their benefits?
We offer educational tools that can be provided by the employer or their broker to the employees. Our assigned account manager and our customer service team is available. We go out for open enrollment. We'll talk to the staff and we'll answer any questions that they have. And I also provide my card to them when I go out to these events. And a lot of times the employees will call me directly. For the most part, everybody calls the customer service department. But a lot of times having the account manager's information kind of puts them at ease, because they know that they're going to, if they can't get their answer from one person, they're going to get it from another. So on top of that, we do the open enrollment for them, as I mentioned. Once they do enroll, then we automatically issue each member an ID card, a benefit summary, and information about their network. They also receive instructions on how to access our web portal, where they can view their plan information, who's enrolled on the plan, what benefits they have, when their plan became effective, how to find a provider. Maybe they need to order a new ID card or just download a temporary one. They can do all of that on their own through our portal.
And check on claims that happen to be in process as well.
Good. Well, that's really good. Well, that addresses the employee role of it. I'd like to follow up on a couple other questions just to make sure we can hit it home on some of the cost effectiveness of a self-insured plan. How do you leverage data to manage the claims and optimize the cost effectiveness of the plans?
One of the things we do is we get together as a team and we evaluate the expenditures for our clients on a monthly basis. And we actually have it set up in all different kinds of categories, so we can monitor trends up or down what the expenditures is doing. And then we could provide recommendations for that plan adjustments for the upcoming plan year, or more immediately if necessary.
And so what type of reporting do you provide to those companies to help them monitor and evaluate their self-funded plans?
We do stuff like we monitor by category, a professional claim, a facility claim, ancillary reporting. If pharmacy costs are monitored, we look at chiropractic separately sometimes. We have special reports that we can pull depending on, we feel like, the medical claims are really high this month. Let's break it down even further and find out why. And then maybe we can come up with a recommendation for them to improve their costs.
Really good. Well, I always like to finish my podcast with some real world scenarios. I think it's important because we can always talk in intangibles of what a self-funded plan is, but when we can talk about some of the success stories that you've had, I think that really makes this conversation a little more tangible there. Can you share with me a success story where you've customized approach significantly benefited a client?
Yeah, we had one client, it's happened on several clients actually, where we were noticing trends of patients or members going to the emergency room for urgent care type activities. They would go to the emergency room, and the cost for an emergency visit versus like an urgent care is sometimes 3 to 4 times what you would spend, what the plan would spend as going to an urgent care. So we monitored that and said, but at that time, that plan actually had the same copay. It was $50 for the urgent care and $50 for the hospital. And so people, for some reason, they think, oh, I'm going to get better care at the hospital. Actually, they're not going to get as timely a care, because the hospitals are dealing with extreme emergency cases to where they'll be put on the back burner if they have an urgent need. So we recommended that the client change their copay structure to where keep the $50 for the urgent care and then charge $200 for the emergency care. And then if the patient was admitted, then you would roll that over and the patient wouldn't have to pay that $200. And almost immediately and drastically, we saw a reduction of costs that were coming out of the emergency room. By all means, if the patient needs an emergency room, go to the emergency room. But a lot of times clients, it's the same cost to them. So they were thinking that it was better care at the hospital versus the urgent care, but the urgent care can meet your needs and you could get in and out a lot quicker. And so it saved a client quite a bit of money.
There it is right there. No, I never really thought about that. And I think that's really one of the huge benefits of, most of us think, well, if I have ABC insurance, the only way I have the ability to save money is to go with DEF. So that in this way, they have the opportunity to kind of keep the integrity of the plan there and make minor tweaks. And then that can show an immediate benefit, especially when it comes to cost savings. Lastly, go ahead.
Let me just tell you an example. It's our own company. We have about 55 people. We have about 40 something people on our dental plan, 48 or so. And if we fully insured, it would have cost us like $38,000 a year to fully insure our dental plan. We would, some of that cost would be offset by an employee contribution, but we actually self-funded and we saved $25,000. We only spent like $7,000 or $9,000 on our total dental plan for the year. It was a very, very comparable benefits, the same cost to the employee. Everybody got what they needed, and we could save a tremendous amount of money by self-funding our dental plan. And for a company this size.
No, absolutely. That's way neat. So I'm glad that you brought up that conversation, because I think that's important for people to understand how powerful a self-funded plan can be. And then let's finish up this podcast with one last question that I have for you. Both of you have decades in the industry, but I'm sure life isn't a straight line. What lessons have you learned from clients that face challenges with self-funded plans, and how did you help them overcome those issues?
I think the biggest challenge is the lack of knowledge, getting them to understand what self-funding is. It took me a while to understand it after I started working here. So I can understand someone from the outside trying to comprehend the difference between a fully insured or self-insured plan. But providing education and examples have been very helpful. We also provide detailed accounting of their plan expenses and reports. When a group accepts our services, we automatically track what it's costing them, but we also track what they were paying before on their old plan. So we show them that chart that shows, had you still been on this plan, this is where your expenses would have been. And now that you're self-funding, you're going to see that those costs are below what you were spending before. And that usually amazes them.
Yeah, it's what we call in our industry benchmarking, right? It's like, well, this is your portfolio, and had you, if you were in the S&P 500, this is how it coordinates with that as a benchmark. And so I think it's important to have those types of tools, because you want to make sure that at least you're trending in the right direction, right? So that's important. Well, ladies, thank you for showing up today. I really appreciate it. If somebody wanted to understand more information about a self-funded health plan, how would they reach out to you? What are your socials? What are all your connections?
Well, they can, a variety of ways. They can look at our website at kernfmc.com. And they can actually contact us through that page. And then we've got a phone number.
They can call our sales line. It's 866-616-4888, or you can call me directly at 661-616-4824.
Okay, great. Well, thanks again for your time today. I really appreciate it. I'm sure that anybody that watches this podcast that is a business owner or even an insurance broker has been enlightened about what a self-funded health plan it is. And an audience, tune in for the next episode of Prime Perspective Podcast. Take care.
Thank you.
Thank you.
Keith Galicia is a registered representative with and securities and advisory services offered through LPL Financial, member FINRA SIPC. The opinions voiced in this podcast are for general information only and are not intended to provide specific advice or recommendations for any individual. To determine which strategies or investments may be suitable for you, consult the appropriate qualified professional prior to making a decision.
Debbie Hankins and Angelica Hernandez are not affiliated with or endorsed by LPL Financial and Prime Portfolio Planning.